must admit, I feel kind of like a skydiver with this getup on. The benefits of being early. I get to be as loud and as obnoxious as I want. Yeah. Okay, so this is the eye examination. This is basically physical diagnosis. Remember this from second year, we went through this. So we first assess visual acuity of the patient using our Snellen chart. Typically we have the patients with a standard chart, we have them stand at 20 feet away from the chart. So we have visual field testing. This is the fishbowl method, basically, where you sit facing the patient, looking into their eyes, you ask the patient to look at you, and you bring your hands immediately from their ears forward, sort of around a fishbowl, as if there's an imaginary fishbowl around them. And you have them point to when your fingers come out. So you have your two fingers, you're coming from the bottom, from the temporal sides, right? That's not really how we were taught. We were taught more like this, where you have the patient, so if patient's facing you, you have the patient cover his left eye, you cover your right eye. And then you go ahead and bring your fingers in. So when you see the fingers coming in for you, the patient should also be able to see the fingers. This corrects for your own misinterpretation of where the visual field is. Doing this, right? We ask them to look up and look down to see opacities. What does perler mean again? Pupils equally reactive. Very good. If the reaction is abnormal in the pupils, we can ask the patients to look at our fingers. I think we're hold it 10 centimeters from the eyes. We ask them to look into the distance and look at the fingers, and look at the distance and look at the fingers. And we'll see if the pupils constrict and dilate properly. We can take a light and shine it from about 2 feet away into our patient, and we can ask them to look straight ahead, and we can actually see where the reflections of light land on their eye, and it should be located just nasally, slightly nasally, correct? But we should darken the room first. If it was an ideal situation, we should darken the room. We ask the patient to look over our shoulder, and remember, it's the right hand, right eye to the patient's right eye, unless we want to be like...
You're interested.
Unless we're interested, exactly. Presentation was more of a field inspection, as in we bring out basically this and our pen light into the field, into wherever we're going, and do it. Today, though, I have the option of going to sleep, then church, then gym, or gym, then church, then sleep, because we have our 24-hour duty tomorrow. I think it's the last one, and you want to be fresh for that, because that's kind of tough, you know. That's all.
Wow.
That's it. Yeah. That's all the camera is. Isn't that cool?
Very cool. That's
technology these days.
It's getting smaller.
Yeah. It's raining. I'm gonna get some sleep, and we're gonna go to church, and then from church we'll try to go to National Bookstore if there's time. Hopefully we'll be able to catch a. Hopefully we'll be able to actually catch a. We go to National Bookstore and try to get something for tomorrow, because tomorrow's another duty. It'll actually be the last 24-hour duty in the ER here at FEU NRMF for us. Just walking past my car. Check this out. This is cute. What are you guys seeing under there? These two little cats just chilling under the car. Look at them. Super cute. You guys just sleeping under my car? Hello. They're just sleeping. They're just totally sleeping in my car.